Hey, do you think you might have a meniscus tear in your knee? Well, in this video today, I'm going to cover with you 3 tests that you can do at home to self-diagnose a meniscus tear. And then we're going to cover 3 important exercises that you need to start doing right away in order to set up your meniscus to begin to heal properly so that you can avoid having to have a surgery later on. And as I go along, I'm going to educate you about the meniscus and why these tests are important, why we do these tests, and also why these exercises that I'm going to show you in this video today are important so that you have a full understanding about what your meniscus is supposed to do, how it behaves, how it becomes injured. Because what I really want for you is to avoid having to get arthritis or some meniscal problem later on that's really bad, and long-term having to avoid a knee replacement surgery. Now, real quick, my name is Dr. David Minoff, and I'm a specialist physical therapist, and I have a company called Paso Manual Physical Therapy. Let's get into it. I'm going to give you the names of these 3 tests, but you don't need to memorize them. I'm just giving them to you in case you want to go look them up and kind of see the research behind them, because they're all research-proven tests at finding meniscal problems. Now, the first one I call a modified McMurray's test. It's from the McMurray's tests. And what you want to do on this test is you'll have to sit or lie down somewhere where you can just kind of support your knee, because what you're going to do is fully straighten it out and fully bend it. Now, if your knee hurts to fully straighten out or bend it or anywhere in between, use caution with this test. Go slowly. You don't have to force yourself to do the test all the way. If you start having pain at any point in the test, it's probably a sign that you have a meniscus tear anyway. So that's confirming of a meniscus tear. So here's how it looks. You're going to start with your knee bent about 90 degrees like so. Then with your foot, you're going to turn it all the way out. Holding the foot out, then you're going to start to straighten your knee with the foot turned out, and then bend your knee, and you might have to assist it, keep it turned out to bend it all the way. Do that a few times. And what you're really looking for, besides pain, is a repeatable click inside your knee. If every time you get to a certain point, like right here, for example, and it pops and clicks, and then when you get back to that same spot, pops and clicks again, that's a sign that you might have a meniscus tear. You can also do the test with the foot inwards. I have not found one more often than the other. They both kind of happen simultaneously for me many times. In other words, I'll test somebody with the foot turned in and then test them with the foot turned out, and they get clicks on both ways. So I would do the test both ways, with your foot inwards and with your foot outwards. Here's how it looks with your foot in. Turn the foot all the way in. It kind of takes some effort to do that. Then lock the knee out as best as you can without pain. Hold the foot in and then bend it all the way. And of course, do this on the side that bothers you. You can compare sides as well. If you've only got one leg involved, then you can see if that click also happens on your other knee. Now, pops and clicks are what you're looking for, not necessarily pain, but it can happen if you have pain. Now, let me just tell you a little bit about this test since we're on it here. Here is a diagram of the knee. This is a side view right here. In red, you've got the meniscus tissue between the thigh bone and the shin bone. This is a front view here, and I've drawn some dots to show you where the patella, the kneecap, would be. The meniscus are right behind it. There's 2 in each knee. And then here, it's as if you took the thigh bone off and you're looking down at the bottom of the shin bone. Let me show you on the bone, on the actual skeleton, what that looks like. So it's as if we took this bone off, and you're looking at the top right here, and the meniscus are right there where my fingers are touching on the top of this bone. They're 2 kind of C-shaped or moon-shaped structures. Outside and inside, there's the kneecap right there. And whenever you turn your foot all the way in or all the way out, it puts more pressure on each of those ones, depending on which way you turn. And then when you go to bend and straighten your knee, you compress the cartilage a little bit. And if you've got any tears or anything in there, then you shift it and might cause a clicking sound. So there's test number 1, the modified McMurray's test. You don't have to have all of these tests be painful or cause a problem with you. I would say if just any one of them are causing a problem with you, then you likely have a meniscus tear. The next test is a little more straightforward. If this is your knee here, you're going to find the joint line, and this is a lot easier than people make it seem. Basically, where the thigh bone, the femur it's called, connects to the shin bone right here, there's a bunch of bumps on the inside and on the outside of the knee. Now, depending on how thick your knees are. You might be able to get to those bumps easier or not. But either way, you're feeling for tender spots. So you're gonna just poke and prod around your knee at about the level of your kneecap. If your knee is more straight than bent, so it's okay to have it all the way straight, but more straight than bent, generally the joint line is gonna be a little bit below your kneecap. So let me just show you on myself. I'm gonna do this. I'm gonna scoot back a bit so you can see my knee. So if this is my knee, my kneecap's about right here. I'm just gonna feel for the bumps on the inside of my knee and on the outside. And then I'm gonna apply pressure on those bumps in different spots. And you can go a little more forward, a little more backwards, but generally if you find a tender spot, say right here on the inside, and you can check a little below and a little above and it's tender in that one spot, you're likely on the meniscus, and that can be a very positive sign that you have an irritated or an injured meniscus. And just to differentiate the two, to explain the difference, an irritated meniscus may not be torn. It may not have anything wrong with it. It could just be irritated. Just like if you scratch your skin really hard, but not enough to break your skin and bleed, it'll get red. That's irritated skin. Give it some time and it goes away. Now, if you cut your skin open, that's an injury on your skin. It is possible to have an irritated meniscus tissue that is painful when you poke it. When you do this test, the modified McMurray's, that can also irritate it. And the other test I'll show you here in a moment might also irritate it. And that's the best news in my opinion. If you've gone to go get an MRI or any imaging, or you've seen some healthcare provider that told you that you very likely might have a tear, it could be that you just have an irritated meniscus, especially if they didn't find anything on the MRI. If you got an MRI and they said, looks clear, I don't know why your knee hurts, then you likely have an irritated meniscus. Anyways, back to the test. So if you're just poking on the insides and on the outsides of the knee, you can slide up and down. If you've got a lot of tissue around, a lot of muscle, hopefully, you kind of have to just push the tissues over to the side so you can get down into the knee joint. And then do that on the other side, just to compare, because if you can find the same area on the other knee, and it's not tender, and that's not the one that's bothering you, it's this one, or vice versa, then you can more accurately self-diagnose the problem at home. So that's the tenderness part of the test. Let me tell you the swelling part. If you just look at your knee and it looks more swollen on one side compared to the other, that's another indication that you very likely have a meniscus tear. Now, swelling can happen a bunch of different ways in the knee because there's so many crevices and cracks. If you look at the knee joint here, the swelling can come out to the front of the knee, right behind right under the kneecap, or even around the edges of the kneecap. It might get a little puffy around that area. Another common site to get swelling is on the back of the knee. Oftentimes they call this a cyst, a Baker's cyst, and that can be really tender as well. And it could be coming from that darn meniscus. So I wouldn't separate out a meniscus tear or meniscus injury from a Baker's cyst necessarily. Although in the medical field, a lot of times physicians, surgeons, they'll separate the two, but they have the same root causes. So they're kind of the same problem in my mind. It's just a matter of how they present it. But let me explain that to you. I want to show you on the whiteboard here. When that tissue gets compressed, the meniscus tissue, it's cartilage, because it goes from the front to the back of the joint. You can see here's the kneecap, that's the front of the knee, and it extends all the way to the back. If there's an injury, say right here, more towards the front of the meniscus, the fluid within the knee, because it's a joint capsule as we call it, meaning it's a contained area where there's fluid for the joint inside the knee. That fluid can go in different directions. It can escape around the edges of the kneecap, or it can go backwards where there's really thin ligaments. The capsule is kind of thin around that area. But you might have the tear over here on the front, and that's causing the Baker's cyst on the back. Or vice versa, you might have the tear in the back of the meniscus. It might be either left or right, but you have more swelling on the front. It's just a matter of your genetics and your activity that leads to having the type of swelling that you have. Oftentimes the swelling might limit how well you can bend or straighten your knee. And it can be painful just sitting around too. So that's another way to read this swelling and tenderness test that I'm telling you about, this second test. So that explains the second test. You're looking for swelling in those areas that I told you about, around the front of the knee and the back of the knee. And then you're poking around for tenderness right at the knee joint line where the bumps are on the inside and the outside of the knee. The third test I'm going to explain to you today is the modified Thessaly test. The Thessaly test is one that a physical therapist or a physician or nurse practitioner might do with you once you go into a clinic to get your knee checked out. But you can do this at home really easily, just like they do it in the clinic. Now this test, let me explain it to you before you try it, because if you know it's going to hurt you, don't even do it. Don't even attempt it. Just count it as a positive test for you, or a ding towards you having a meniscus tear. You're going to be standing on the leg that hurts you. I'll get up on the table in a moment so you can see exactly what my leg's doing. But you're going to stand on the leg that hurts you with your knee slightly bent. Let me show you what's happening here on the skeleton. So meniscus is right here between the bones. You're going to slightly bend your knee, and then you're going to twist your body so that your knee twists in and out. And what it's going to do is compress your cartilage quite a bit, the meniscus tissue between your knee. And if it's irritated or torn, it's going to hurt it. So if you know that that's already going to hurt you, you might have already taken some bad steps in the past, recently today or in the past few days, and you knew that it hurt you, count this as a positive test. But let me show you what this looks like. I'm going to get up on the table. And when you do this test, you definitely want to use something for balance. I'm going to balance with the wall behind me here. And all you're doing is standing on one foot, slightly bending your knee. You can toe tap as well with your, touch your toe down with your other foot if you need to. And then you're just twisting your body one way and the other while the foot stays in place so that you can twist the knee joint. And if you twist, the idea is to start with small motions like that, see if you're okay, and then go to the extreme, really twist your knee as far as it'll go in each direction to test it. And besides some stretching and pressure in the knee, that's what you should normally feel. It shouldn't hurt. It should just feel like pressure and some stretching through the knee joint and other parts of your body. But if you have a meniscus injury, a meniscus tear, it will hurt. And it's weird. We have some people that this test I've seen is more sensitive. In other words, it tends to set it off more often. But we have some people that have some massive tears and can tolerate this just fine. And then we'll use some of our other meniscus tests and they light up with those. So everybody's a little bit different. That's why you need to use these three tests, because it's rare that there's going to be multiple tests that give us the same outcome. You've got to kind of do a little trial and error and see which ones are best for you. But if you've got a history of knee problems, if your family has a history of knee problems, you suspect that it's a meniscus problem, you've got the clicking, the popping, the swelling, all these signs kind of coming together, then it's highly likely that you have a meniscus tear. And you got to trust your gut on this. With the education that I'm giving you and maybe you pick up from other places, you got to trust your gut on this. Let me give you a little disclaimer at this point, because diagnosing a meniscus problem needs to be done with a physician, with an orthopedic surgeon, or with a nurse practitioner, somebody who is supposed to diagnose this for you. Likely they'll get an MRI or some other imaging study that they deem appropriate to look inside your knee and see if there's a tear. Only at that point can you officially, legitimately be diagnosed with a meniscus tear. But you're here looking at this video right now, trying to figure this out for yourself. And if you think that you have meniscus tear, you probably do. I believe my clients almost every time, whenever they're telling me what they've got going on, I'm just confirming it for them so that we can make a plan to fix it. That being said, I'm going to show you the exercises here next so that you can start to heal this meniscus problem naturally. But before I do that, I want to mention our 28-day knee health and wellness boost program. This program is me on video taking you over the course of 28 days of boosting the health of your knees so that you can have better health through your knees, better wellness in your knees, so that you can avoid surgery, avoid medications and injections while getting back to being active, healthy, and mobile. In this program, I detail a bunch of exercises, of progressions. I give you tons of knowledge through the videos as well. And people get better in their knees. Their inflammation goes down, their swelling goes down, their ability to do things gets better. There's a link to this program in the description below. If you just go down there, find the link, you'll get to a video and opportunity to purchase the program if you want. The exercises I'm going to cover with you here today are the first step so that you can begin to get some relief today and start to give your knee a healing environment for that meniscus tissue. The very first exercise I'm going to show you is called a inward heel slide. And the reason why we do this exercise is because of the pressures that are going through the knees. Let me just show you on this chart here on the diagram. So if you look at the knee on this side, it's a side view. So you can see the foot down here at the bottom, the shin bone here, there's the meniscus in red, the kneecap in front of it, and then the thigh bone up here. What you have to understand is the knee joint is a hinge joint, meaning it only bends and straightens. It basically has one dimension of movement. It only goes in one way. But up at the hip, you have multiple dimensions of movement. You can go forward and back like the knee can, but you can also move inwards and outwards, like to the side and towards the middle. And you can also rotate. Because it's the same bone that connects the hip and the knee, the thigh bone, the femur, if you have not the best rotation control, to put it simply, up at the hip, that's why I drew this arrow here that rotates. If your thigh bone tends to rotate inwards, it will cause excessive pressures on usually the inner meniscus here. Sometimes it's the outer meniscus, it depends on a few variables. If you have excessive rotation through your thigh bone because of some weak hip muscles, so it's hip muscles that we need to look at, then that sets you up for this meniscal tear. So the exercises I'm going to show you today, we're going to cover 2 glute exercises, but the first one is going to be to get the alignment correct in the knee, because 8 times out of 10, when we see a client here in the clinic for a meniscal tear, they have what's called a tibial shift. So the shin bone here, the tibia, is shifted because of the rotation that's been happening over the course of months or even years. And we need to shift that bone back into position because it'll shift the meniscus with it and start to grind and wear the meniscus improperly. So this first exercise looks like this. I'm going to tip the camera angle down. So here's how this inward rotation exercise looks. You're going to kick off a shoe because you don't want the grip of your shoe, the sole of the shoe, to be stopping you from doing this. And what you're going to do is turn your foot inwards and bend your knee, just like so. Go as far as you can. Then once you go as far as you can, start over again by stretching out your knee and turning your foot inwards. And just like so. This is not a strenuous exercise. It should feel fairly easy. And what you want is for the inner thigh muscles, kind of more on the back, the hamstring area, to work just a bit. And you're trying to really force your foot to go inwards as much as possible, because that creates inwards rotation at the knee to settle the joint in the right position. I often get asked, should I go outwards? And I usually don't tell people to go outwards, but I'm not going to stop them either. They just feel like it helps to go outwards. That's fine. By doing that rotation in the knee, you usually get the alignment just right. So it's fine to go either direction. And then what you want to do is about 2 minutes worth of this, several times a day. I would do this every 2 hours if you're really severe. If you're less severe, you could probably get away with just a few times a day, like 3 times a day of 2 minutes of this exercise. Usually after doing this, people feel fantastic. They feel a little better. They feel like they have better motion in their knee if they're stiff. And it helps to get the alignment right so that we can begin to do those glute exercises. Let's cover those next. The first butt exercise I want to show you, because it helps out that control at the knee, it's called the fire hydrant exercise. It's a common exercise, but I want to make sure that you're doing it just right so that it really burns the butt muscle. So you're going to get up on all fours. Well, on the floor is fine, but you're going to be on all fours, like with your hands and knees. It doesn't matter if you're flat-handed or on your fists. Just get kind of comfortable here. Then what you're going to do with the leg that's in question here, and by the way, if it hurts to kneel, put a pillow, put something soft under there, and you're going to offload it anyway, so you don't have to be putting pressure on it very long. And you don't have to bend back a lot either, so it shouldn't be a real uncomfortable amount of bend in your knee. So what you're going to do here is think about squeezing the butt muscle of the leg that you're lifting. So in this case, it's going to be my right leg. I'm going to tighten up the butt muscle as hard as I can and stretch out the hip. So pick up my foot in the air like so. Then what I'm going to do is rotate my knee outwards, continuing to tension up my butt muscle, and hold it there for 10 seconds. You should feel the butt cheek on the leg that you're lifting slowly stiffening up, working hard, and eventually getting on fire. After 10 seconds, put it down,
Take a break. You can do both sides if you want, but for the sake of teaching you this exercise, I'm going to stay on the right. So straighten it out, turn it out, and squeeze it. Hold it there for 10 seconds, and then come down. Now, how high you lift your foot and your leg isn't super important. What's most important is that you feel the butt working. Just like that. And really focus on squeezing your butt. I would not focus on, if you're watching this video right now, putting your body in the same exact position, because everybody's got slightly different genetics. You might not move the same way I do. If you only get to here and you already feel your butt working and you're squeezing it really hard, good, that's where you need to be. If you get way up here for you to feel it, that's fine too, as long as it's not hurting anything like your back especially. And you don't want to set off any hamstring cramps too, so it's okay to work it from down here and just lift like that if your hamstring's starting to cramp quite a bit. Like right here, I can feel my glutes still working. Now it does work more intensely at this angle, so I'm going to stay right here. After about 10 reps, or if you get really tired, or if you feel like your hamstrings wanting to kick in a lot, that's your stopping point. You can be done with that exercise. Now, there's a lot more butt exercises that are going to be great for you, but I'm going to cover with you tailgate swings just because it is a foundational movement for healing meniscus tissue, for regenerating cartilage through healing and scar tissue. And it's so simple to do. It's easy, just takes a few minutes several times a day. And you can do this from virtually anywhere, not just your home, but if you're out somewhere. I'm gonna angle the camera down just a bit so you can see my knees. And it's this easy. All you're gonna do is sit somewhere where your feet dangle. An ideal place is a bar stool or a computer chair that's lifted up all the way. And just move your legs back and forth. You can move them a lot if you want. You can move them a little bit if you want. But what you're doing here, whenever you are moving your knees like this real gentle, is the fluid that's inside your knee joint. It's called synovial fluid, the joint fluid that's in there. You swish it around, and because you're not standing on your legs, the joint is unpressured, it's depressurized, and it allows the fluid to get in areas a little easier. And this gentle motion is just kind of lubricating things. The fluid's really important to get around all the different edges of the joint because it has nutrition for the cartilage. One of the things that is always brought up with cartilage regeneration, especially with the meniscus, is that it doesn't have a good blood supply. And that's true. It doesn't have a good blood supply, which means it's not going to heal as fast, and it may not even heal in certain areas is the thought. But I beg to differ. I think there's research out there that does show that the fluid itself has nutrition in it. It has the right stuff for healing for the meniscus, but we don't get it in there enough. And this is one of the things that can get it into all the crevices and nooks and crannies of the knee joint. So what I recommend doing, especially if you're very flared up, is 5 minutes at a time minimum. If you can tolerate doing more, 10, 15, 20 minutes. And I would do this every hour or two throughout the day until that inflammation goes down, until you're able to bend and straighten out your knee better. That will tremendously help with setting up the knee to heal so that you can escape having to have a meniscus surgery or later on in life, arthritis and other unnecessary surgeries. This simple tailgate swinging sets you up to do amazing things with your meniscus. Now keep in mind, there's just a couple more things I'm going to detail for you in this video. Keep in mind that this is a process over time. This takes, I gotta get serious with you here for a moment. This is a process that takes some time. This does not fix your meniscus tissue, within a few days or a few hours or even a few weeks. Meniscus tissue doesn't heal instantly. It takes months. We're talking like 6 to 12 months to heal fully. Now that doesn't mean you're going to be in pain all that time. It just means that it's not 100% healed. You will likely get 70 to 80% healed within a few months of doing the right things. You've got to strengthen those butt muscles. You've got to put the knee joint in proper alignment. And you've got to give it tons of nutrition through the synovial fluid, the juice inside the joint juice. And all these 3 exercises are the first foundational exercises to get going. If you want to get a slew of exercises, the whole program, all the progressions, go ahead and check out that 28-day knee health and wellness boost program. The link's in the description, and you can get all the exercises in there. We also offer a bit of support online, so you can email us questions, and we're happy to answer some questions for you so that you can get the help that you need for your meniscus problem. I've got a question for you. If you tried these exercises, if you tried these tests, did they work for you?
Did they help? Did they hurt? I want to know so that we can provide the best help for you out there. Drop a comment and let us know if it helped or hurt or did nothing. I want to know so that we can develop better and better information on our videos over time. I appreciate it if you drop one of those comments. Also, if you did find that it was helpful, please leave us a like and hit the subscribe button over there and turn on the notification bell so that you can get notified whenever we release a new video to help you out in avoiding surgery, medications, and injections so that you can be happy, healthy, and active. Have a wonderful day, friends. Bye-bye.